Hi, my name is Brian Kott. I'm the Executive Medical Director for MultiCare Health System, and I oversee the stroke program for the entire hospital system here in the South Sound. So what I do is a little bit, not typical of what we do. I'm actually a neurointerventional surgeon, which is a fancy term for a brain plumber, essentially. What I do is minimally invasive surgery to treat diseases that are involving the blood vessels that go to either the brain or spine. And in particular to stroke, we treat people who are actively having acute stroke by being able to remove clots or treat brain aneurysms or whatever the problem is inside the brain. You know, I give talks out in the community, and I always start my talks by asking people, okay, you have to choose one or the other. For everybody in the room, you have to choose, would you rather have a heart attack or would you rather have a stroke? And that's not really a fair question at all, but it gets people thinking, and overwhelmingly, almost everyone in the room chooses heart attack. And part of that is because there's been a tremendous amount of education regarding heart disease in our country. We have come a long ways in heart disease. We've come a long ways in stroke, but we haven't done as good a job of being able to communicate that to the public. And so there's this mystique around stroke where it's like, oh my gosh, is my family member, they're going to be different and whatnot. There's just so much more education that we need to do with stroke in the community so that people can understand. I think starting with the fact that there's actually treatment options available for stroke. When I first started many years ago, stroke patients, it was kind of like, well, they'd come into the ER and they had a stroke and there wasn't a whole lot you could do about it. Well, now that's completely opposite. Patients come into the emergency room department and we start an entire protocol that is rapidly evaluating patients to where we can actually treat them and treat a large percentage of patients who patients otherwise would have maybe been devastated and gone to a nursing home are actually instead going home. Being able to bring someone back from a potentially devastating injury to where they're recovering, I mean, it's an amazing experience for the whole staff. I mean, not just for the physician staff, but the whole staff. I mean, patients will come into our operating room not able to talk, not able to move one side of their body, sometimes not even able to breathe, and we're having to breathe for them. And then we pull the clot out, and it's amazing. They will literally wake up right in front of us. It's very satisfying to be a part of, for sure.